Hello guys, welcome to Meded. My name is Nicholas and I'm a pharmacy practitioner. I'm very glad and I appreciate for taking your time to watch this video. So if you've not subscribed, please ensure that you subscribe after or before watching this video, and also hit that notification bell so that you'll be notified the moment I post other videos such as these ones. Okay, so today we are going to delve into a totally different topic. I'm talking about contraception. This is an essential tool in reproductive health and family planning. Okay, so in this detailed video we are going to break down what contraception means, different methods of contraception, who should use it and who should not use it, and how this method works. Okay, and also the pros and the cons of these methods, and also the side effects, the common precautions, and many more. But before I begin this topic, allow me to raise this disclaimer. This video is basically for informational and educational purposes only. It is not meant to replace the advice from your healthcare provider. So ensure that before making any decision on any medication or your health, consult your physician or the healthcare provider that is at your disposal. Okay, so let's delve into today's topics. So what is the meaning of contraception? Contraception is a device or a method that is used to prevent pregnancy. Okay, by so doing, the individuals are able to make decisions on when or whether to get or have children. Okay, so these methods will work in different ways. Okay, there are those ones that target the sperm and block it from accessing or fertilizing the ovum or an egg, and there are those ones that block or stop ovulation instantly. Okay, methods of contraception. So we can classify contraception into different categories as shown here. Okay, by this I mean barrier methods, hormonal methods, intrauterine devices commonly known as IUDs, and we have natural methods and permanent methods. So let us delve into discussing each of these methods of contraception. So we are going to begin by barrier method. Barrier methods physically block sperm from reaching the egg. They are non-hormonal and can be used on demand. This includes the use of male condoms. So some of the advantages: that is cheap, it's widely available, it protects against both pregnancy and sexually transmitted infection. Its disadvantages is that it requires proper use every time and may break or slip. And some of its side effects is that though the side effects are minimal, though some people may have latex allergies, but there are non-latex options in the market. Some of the common precautions that is that it's perfect for most people. However, those who are allergic to latex should use non-latex varieties. We also have female condoms, which is just the same as I've discussed the male condoms above. Okay, we also have diaphragm. So on how to use this diaphragm. So what is diaphragm? Diaphragm is a shallow dome-shaped silicone cap inserted into the vagina to cover the cervix. It is used with a spermicide to prevent pregnancy. The advantage is that it's non-hormonal and it can be reused, and it provides some control over contraception. Okay, its disadvantage is that it requires fitting by healthcare professional and must be used with a spermicide. Some of the side effects is that it is a risk. If you use it, you are at risk of getting urinary tract infection, commonly known as the UTI, because of the pressure on the urethra. Okay. Some common precautions is that it's not suitable for women with a history of urinary tract infection or toxic shock syndrome. Another method of contraception that we're going to discuss is hormonal methods. So hormonal contraception uses synthetic hormones to prevent pregnancy by either stopping ovulation or thickening cervical mucus to block sperm. Some of these methods include the use of birth control pills. These include combined and progestin only pills. Okay, so how does this method work? So combined pills contain estrogen and progesterone, which works together to stop ovulation and thickening cervical mucus. Okay, progesterone only pills work by thickening the cervical mucus and sometimes also preventing ovulation. So advantages of this method is that it regulates menstrual cycles and reduces acne and menstrual cramps, and offers a 99% effectiveness and a 9% effectiveness rate when used correctly. Disadvantages is that must be taken at the same time every day. So mark this, it must be taken at the same time every day. With missed pill increase, so if you miss any pill, you'll increase the risk of getting pregnancy. Some of the side effects include, when you use them, you feel nauseated, you can maybe gain weight, you may have some mood swings, okay? You may experience some spotting between periods. Some women report changes in libido, okay? Meaning that sexual drive, you may not have it. You may or may not have it, okay? So some common precautions that is not recommended for smokers, okay, over 35, or people with a history of blood clots, high blood pressure, or certain cancers, okay? So if you have this condition, please just don't use it. Another method under hormonal methods includes the use of hormonal implants. This common one known as Nexplanon. Okay, how it works. Okay, so Nexplanon is a small rod containing progestin. Is implanted under the skin of the upper arm, and it by planting it releases the hormone gradually over 3 years to prevent pregnancy. So its advantage is that it provides long-term protection up to 3 years. No need to remember daily pills, and is highly effective. Its disadvantage that it can cause irregular periods, mood swings, and weight gain. Okay. So some of the side effects include similar to, so the side effects of this pill is similar to other hormonal methods, okay, like headaches, mood changes, weight gains, and many more. So the precautions, just to caution you, that it's not suitable for those with the liver disease or breast cancer. Okay. So another method under hormonal method is a hormonal patch. There's this one called Ortho Evra. Okay. So how does it work? It's a small patch worn on the skin that releases estrogen and progesterone into the bloodstream, preventing ovulation. So its advantage is that it only needs to be charged weekly. Okay. So, and it's easy to use, and offers a steady hormone. It offers a steady hormonal levels. Okay. Its disadvantage that is less effective for women over 198 pounds. So if you are overweight, it may not be a good choice for you. Some of its side effects includes nausea, headaches, and increased risks of blood clots. Some common precautions include some common precautions are similar to other birth control pills. Okay, so avoid it if you smoke or have certain health conditions. Another method of contraception that we want to discuss is intrauterine devices, okay, or IUDs. So intrauterine devices are small T-shaped devices inserted into the uterus to prevent pregnancy. There are two types, hormonal and non-hormonal. The non-hormonal one is called copper. So both of these devices work by affecting sperm motility, preventing fertilization. So let's look at the copper IUD. So the copper IUD creates an environment in the uterus that is toxic to sperm, hence preventing fertilization. The advantages of using copper IUD: it lasts up to 10 years, and it is non-hormonal and can be used as emergency contraception if inserted within 5 days of unprotected intercourse. Okay. For more information, I'll explain there later if you've not understood that. So its disadvantage: it can cause heavier periods and more cramping, especially in the first few months. Some of the side effects include spotting, cramps, okay, and the precaution that I can give here, that is not suitable for those with the copper allergies or heavy menstrual bleeding, because if you use it, you may lose a lot of blood if you experience heavy bleeding. Another method that I want to discuss is hormonal IUD, e.g. Mirena and Skylar. Okay, So this method, it releases small amounts of progestin to thicken cervical mucus and sometimes prevent ovulation. Its advantage is that it lasts 3 to 7 years depending on the brand and can reduce menstrual bleeding and is highly effective. Its disadvantage is that it can cause spotting and irregular periods in the first 6 months. The side effects are that is similar. The side effects are similar to other hormonal methods. Okay, these include headaches, mood swings, breast tenderness, and many more. So the precaution while using this method is that it's not suitable for those with pelvic infection or certain uterine conditions. Okay, another method that we want to look to discuss about is natural methods. Natural methods involve tracking woman's ovulations, just basically tracking the ovulation cycle of a woman to determine the days when she is most fertile and avoiding unprotected sex on those days. Okay. Some of these methods include fertility awareness methods, that is FAM. So it talks by tracking the menstrual cycle using temperature reading, cervical mucus observation, or calendar method. Its advantage is that no medical intervention or side effects. It is non-hormonal also. Its disadvantage is that it requires strict adherence and daily tracking. Effectiveness can be reduced by stress or illness affecting the cycle. Okay. So some of the side effects, it doesn't have any side effects. So some precaution not recommended for women with irregular cycles. Okay, so if you have irregular cycle, this method is a no goes on for you. So it's also not recommended for those who cannot commit to daily tracking. So if you are pure in daily tracking, please don't use that method because you just end up in shock that you are pregnant the other day. So another method is a permanent method. Permanent methods provide a long-term solution for those who are certain they do not want children in future. Okay, so this method include vasectomy for men. So there was difference. The tube carrying sperm from the testicles are cut or sealed, preventing sperm from entering the ejaculate. Okay, the advantage is that it's highly effective permanent solution for men who don't want more children. A disadvantage that is permanent and requires minor surgery and can take several months for the procedure to become fully effective. Okay, so side effects are temporary. Side effects include temporary pain or swelling. So common precautions, I can say that they are suitable for men who are 100% they do not want future children. Another method that falls under permanent include tubal ligation for women. So the fallopian tubes are cut, tied, or blocked to prevent eggs from reaching the uterus. Its advantage that is permanent and highly effective with no ongoing maintenance required. Its disadvantage that it requires surgery and is reversible and involves some recovery time. So side effects include possible short-term pain, cramping, or complications from surgery. So some common precautions that I can give you that is not recommended for women who may want children in the future. So, well, as you can see, contraception comes in many forms, each with its pros, cons, and suitability for different individuals. The best method for you, I can advise, will depend on your health, lifestyle, and your future plans. So please ensure that you consult your healthcare provider before making any decision regarding any contraception you may want to use. So if you found this video helpful, please give it a thumbs up, subscribe to MedEd, and hit that notification bell so that you'll be notified when I post future videos such as this ones. Thank you once more for watching this video, and I'll meet you in my next video. Stay healthy and stay safe. Bye bye.